Good morning, good afternoon, good evening, depending on where you are. Um, my name is Toss Cochran. I am the director of the online fellowship and certificate program at the Center for Bioethics at Harvard Medical School. And I'm going to be giving you a bunch of information about our program and other programs at the Center for Bioethics. And you are welcome to ask questions. You can put them in the chat. And I don't have so much content that I can't answer a question on the fly. So please do feel free. Um, I'm going to introduce myself in a little bit more detail in a moment, but first I thought it might be helpful to explain what the fellowship is, if you're not already familiar with it. It is a part-time academic fellowship that meets once a week from January through June, approximately 25 sessions. And we meet for between 2 and 2.5 hours. Um, on the screen, you'll see that we're currently scheduled for Thursdays, running from 9 a.m. to 11:30 a.m. Eastern Time in the US, but that is subject to change, and it may depend a little bit on the makeup of our fellowship and what time zones the fellows find themselves in. Um, the meetings are all held via Zoom. And there is an optional in-person experience that we're still planning in Boston for next year. This year, I think 22 out of 26 fellows managed to make it to Boston. And it was really a wonderful couple of days seeing each other in person. Um, the online fellowship is something that just finished its inaugural year. We created the online fellowship after a few years of teaching our original fellowship in bioethics via Zoom because of COVID. And that taught us that it was possible to have a really robust fellowship and experience um, online. And so now there are two fellowships. There is this online fellowship, and there is the original in-person fellowship in Boston, which is more tailored toward people who live in the area and can be in Boston every Friday in that case. So let me explain a little bit about who I am and who my co-director is. I am a neurologist and medical ethicist. I was an attending neurologist who specialized in neuromuscular medicine at Brigham and Women's Hospital in Boston for about 17 years, if you include my training. And I was I completed this fellowship in medical ethics 20 years ago. And then I was a faculty fellow at the Safra Center for Ethics, and I completed several other ethics educational opportunities. And so a big part of my career has been medical ethics from a variety of perspectives. A lot of my writing has been in ethics. I was a clinical ethics consultant at the Brigham for many years. I sat on the IRB and have been involved in policy at a number of organizational levels. I have also spent several years in doing drug research in the pharma industry, and so I bring a bit of perspective on pharmaceutical ethics, which is one of the topics that we do cover in our fellowship, and also the design and implementation and ethical conduct of research. My co-director has been the director of the fellowship for, I believe, since 2001, and was the director of the fellowship when I was a fellow 20 years ago. Millie Solomon is the president emerita of the Hastings Center, and so is a globally renowned bioethicist. Her original training is in education, and she has led a number of organizations and has a lot of experience in comparative effectiveness research and medical education and bioethics education. And she is one of my favorite people in the entire world. And so when she asked me to come co-direct with her and also create this online fellowship, I couldn't have been more thrilled. She and I are part of the Center for Bioethics, which is a standalone center that recently celebrated its 10th anniversary as a standalone center at the medical school. Rebecca Brendel is the director, and Ed Hundert is the associate director of the center. And the Center for Bioethics oversees a number of educational opportunities. There are, of course, the two fellowships that I just mentioned. There's also a very large master's in bioethics program. And there is teaching of the medical students at HMS in a variety of ethics courses. And then the center also oversees the training in responsible conduct of research. And so there's a lot of ethics education going on at the center. There is a lot of leadership and writing and policy influencing and speaking at the center. And so it's a really robust and active place to be and place to learn about bioethics. The fellowship has always been designed for people who are working professionals. Typically, we have talked about it as people who are mid-career and already working in their chosen field. That field is typically in the life sciences, healthcare, or related fields. But we've been quite broad about this, and we've had a number of people who have worked in social medicine. We've had people who are trained as anthropologists. We've had veterinarians. We've had lawyers. We've had we've had hospital executives. We've had all sorts of professions involved. And all that we expect is that they'll be working at the intersection of the life sciences and have a desire to learn more and engage more in bioethics. The original conception of the fellowship was to develop more ethics expertise at the Harvard teaching hospitals. And so I believe next year will be the 34th year of the fellowship. And so originally it was quite small, and it tended to be nurses and physicians who were already engaged in some ethics activities at their hospitals and who just wanted to develop their knowledge and their skills. But as I said, we've gotten much broader and more inclusive, and the list of topics is now quite broad. I'm not going to go through this entire slide. I'll let you sort of look at it while I chat a little bit about the categories here. As you can see, the sessions, which are in the black text, we've kind of roughly grouped them into sessions regarding the history and context of bioethics. We spend a considerable amount of time on ethical theories and modes of moral justification, which we really think of as the philosophical underpinnings of ethics and the type of framework that gives you what you need to tackle selected topics in clinical ethics. And we've got a wide range of topics here. The curriculum does change from year to year as new topics emerge. You can see down in the lower right, there's a session on big data and AI that's only a few years old. We have been evolving our pharma ethics section because of my particular background, and I bring a number of cases to the table. There is a little bit more emphasis in the online fellowship on international and global health concerns and more discussion of the ethics of global distribution of resources. And one of the things that is important to know about the fellowship is that the fellows learn from each other, and Millie and I learn so much from the fellows. The fellowship has been quite diverse, and a lot of what I really loved about our first year with the online fellowship was that we had the fellows bringing a global perspective to all of these topics so that we weren't quite so North America centric. I've already mentioned that the fellowship has been ongoing for more than 30 years, and I've said a little bit about Millie and myself, but we've got guest speakers for most of the sessions that I was just showing you. And we're very lucky to be able to attract folks who are really expert in their fields, tend to be very well known, and are very good at teaching their subjects. Um, and then again, the participants too tend to be, very high quality, very experienced. They bring their own perspectives because we tend to be a group that's mid-career. People have lots of experience. They have lots of cases to bring to us, and so the conversation tends to be really rich and can go quite deep. The admissions process is described on our website, but here it is. There is an online application, and it's fairly straightforward. We ask for a curriculum vitae, a statement of purpose, and 3 letters of reference. So the details of this are described on the website, but the statement of purpose should be no more than 750 words. And it's really important because it's your opportunity to tell us who you are, why you're interested in training in bioethics. If you've got experience in bioethics, we want to know about that. And again, the vision of the fellowship is that you will take what you learn, you'll take away the connections and the friendships that you make, and you'll bring that experience back to your home institution, and thereby enrich what's going on at your home institutions. Um, the applications are open now and are due by September 1st. We intend to have decisions by mid to late October. The program fee will be due in mid-January of next year, and the first session is currently planned for Thursday, January 8th, but that will be confirmed over the summer.